Hi, my name is Allison. I'm the pharmacist at True Compounding Pharmacy. Today we're going to talk about how to properly take the medications that we've prepared for you, proper storage instructions, and any possible side effects. Compounded hormone troches are custom-made medications that deliver bioidentical hormones such as estrogen, progesterone, DHEA, and testosterone through the gum and the cheek. This method of administration increases absorption of the active ingredients to make sure that you're getting the most accurate dose possible. They can be provided in different bases, and the two current bases that we use for our troches are either a gelatin base that's kept in the refrigerator or a PEG base, and that doesn't have to be kept in the refrigerator. Hormone troches are commonly used for menopausal symptoms, any changes or irregularity with your menstrual cycles and symptoms that may arise with it, low libido or sexual dysfunction, fatigue or mood swings, and just overall imbalances in your hormones.
First, be sure to wash your hands before and after handling your troche. Perform your usual oral hygiene before inserting your troche. Remove troches from the cardboard sleeve by sliding the insert to the right or left. Open the hinged plastic troche package. Push up on the bottom of the troche square you wish to remove. If your prescription calls for a fourth or a half troche as your dose, use a sharp knife to cut the troche using the scored lines. Place the troche between the cheek and gum. Do not chew or swallow it whole. After inserting the troche, place your finger over the exterior cheek where the troche is located and gently press down. This will allow the troche to adhere to the oral membranes and stay in place as it dissolves. Let the troche dissolve completely. This may take between 15 and 30 minutes.
Some patients may experience common side effects that can include mild mouth irritation, breast tenderness, fatigue, headache, acne or oily skin, or changes to your menstrual cycle. Please be sure to contact your provider or your pharmacy if you experience any of these symptoms and they persist. Keep your troches in their original container, and they can be kept in a dry area that's at room temp. Just make sure you're keeping it away from any excessive heat. If it's the gum-based gelatin troches that you're getting, you want to make sure you keep those in the refrigerator, but if it's just a regular base, just keeping them at room temp. Hormones can be transferred to others, so please make sure we keep it out of reach of children, of any animals, and just other people. It's important that this medication that was custom made for you is being used by yourself. If you have any questions about your medication, please contact us at True Compounding. We're available Monday through Friday from 9 a.m. to 5 p.m.